Coming soon, Dr. DILF, the health podcast on Podbean for older gay and bisexual men. I'm your host, Dr. Simon Fox, and each episode I talk to experts about your health. I have a chat with a personal trainer about physical exercise.
When taking on an older client versus a younger client, generally speaking, because there's always exceptions, but the first thing I'm going to do that's a little bit different is the type of exercise we do with them and kind of the overall amount.
I talk with a counsellor about mental health.
I guess it's what ties in with that health thing where we're sort of making ourselves do something, we're always punishing ourselves. We don't want to be doing anything like that in counselling. It's not about telling us that we need to do this, we need to do that. It's about being kind, to ourselves, compassionate to ourselves, being that friend to ourselves and helping us.
I discuss dementia with a carer and campaigner.
Counted every appointment, and it was something like 118 appointments over those almost 3 years. Now, that's an enormous amount of time. There were tests and hospital visits and GP visits, and it was relentless. And I quite like to put that out there as a kind of an example of what you might face.
I learn about HIV services and PrEP in the UK.
And generally, we would see people when they were first diagnosed. For that first year, they'd come and see us routinely. And we would often actually, if someone was confirmed as having an HIV positive result, we'd actually offer them treatment at that point. Do you want to start now? Some people did. Some wanted to wait until they actually saw the doctor.
And in America.
If you are on the long-acting injectable for PrEP, the one that is every 2 months, or that's injectable cabotegravir or Apretude, you will need to make a minimum of 6 visits a year.
Every episode is followed by Dr. DILF Extra Length, where 3 older gay men shoot the breeze about the topic of the week.
The cringe-worthy words of, well, it's quite common for men of your age.
Oh, no! You can join in the conversation using the Dr. DILF hashtag on social media and by visiting drdilf.co.uk, where you'll find all the episodes, show notes, a blog, and so much more. Dr. DILF, let's get talking!